Hello everybody, in this video we are going to discuss about Down syndrome. You can see the cute baby with Down syndromes, and here as well we will be confirmed, or we will be sure why this baby is called Down syndrome after this video. So starting, Down syndromes occurs due to the trisomy 21. The main causes for trisomy 21 is non-disjunctions of the maternal chromosomes. It occurs in almost 90 to 92 percentage. This occurs during the meiosis, and this is associated with advanced maternal age non-disjunctions. And second is balanced translocations. It occurs in almost 5 to 7 cases. It is also called functional trisomy, and this most common is translocation 1421, and the one having translocation 1421 has the risks of Down syndrome very much. So, and another is mosaicisms, which occurs in 1 to 2 percentage. So we can see here is the trisomy 21 and translocations of 21 and 22 chromosomes. You can see clearly here. So let's now discuss about the clinical features. We have typical Down faces. This is the typical Down faces. Here we can see, and here as well. There will be flat skull, means brachycephaly. Brachycephaly means there is a premature fusion of the coronal sutures, and there will be Mongoloid slant of the eye, means the eyes are like this, like that. Here, shown like this. There will be the flat nasal bridge, open mouth with protruded tongue. We can see that here, open mouth with protruded tongue, low set ears. The ear will be so small. Where is it? Yeah, here it is. And in limbs, we can say single transverse palmar crease, which is also called simian crease. Only one line. We normally have 2 to 3 lines, but in case of Down syndrome, will be only single line in the palm. If you go in the eye, we can see Bosfield spots in the iris. You can see here in the iris there is Bosfield spots. There might be nystagmus, strabismus, and cataract. And the patients might be hypertonia, which increase the risk of umbilical hernia. We can see the cute baby with umbilical hernia. In the skeletal, there might be atlantoaxial instability, which risks increase high risks of the cervical spine injury. So accident might occur. So we must immobilize the spine. In feet, we can see the sandal gap, means the gap between the wide gap between the great toe and the second toe. As we can see here, great toe, second toe, there is the gap. And cleidodactyly means small little fingers. There might be obesity, hypothyroidism on descended testes, congenital heart disease, most commonly endocardial cushion defect, ventricular septal defect, and atrial septal defect. There might be the increased risk of leukemia. Most common is the acute lymphoid leukemia, and most specific is the acute myeloid leukemia M7. And there might be transient myeloproliferative disorders, and the most common genetic cause for mental retardations is the Down syndrome. But most common inherited cause for mental retardation is Fragile X syndrome. So that's all. Thank you very much.